What's going on, everybody? And welcome to episode number 15 of Think Like a Marketer, where we interview marketers, entrepreneurs, and innovators. Today's guest is a special guest, not just because he's here, and I'm saying that, well, partly that is, he is here. No, that he has taken on a passion that I feel passionate about myself, and that is medicine. In January 11th, I lost my mother to cancer. And I think with my whole heart that had she had a primary, well, she had a primary care physician. She just didn't go to him often enough because she felt like she was healthy. And had she utilized that, had the right resources, I think that my mom would still be with us today had she gotten true health care and not sick care. Because when she found out that she had cancer, colon cancer, stage 4 colon cancer, no less, it was a little too late to. It was just, how long can she survive? Using chemotherapy. So that has become a mission of mine to figure out, how do we convince, number one, Americans that, hey, we should absolutely have a primary care physician, someone who's looking out for our best interest, not when we're sick, but keeping us actually from getting sick. So I have a special guest today that is, his sole mission is to do absolutely that. And his name is Dr. Goyal. Dr. Goyal, hey, thanks for taking your time. Doctors, their time is super valuable. So I appreciate you taking the time, jumping on here with us today, and sharing what your mission is today. I wanted to give you the opportunity to kind of tell us a little bit about your background first, and then what took you to really want to grab this. It's such a challenging mission. I mean, let's be honest. This is a big deal right here.
Thank you, Randall. I'm excited to be here with you today. And, I am a physician. I trained in internal medicine and pulmonary and critical care medicine. So I was training to become a specialist. And I, did become a specialist. And what you realize in healthcare, both as a patient and as a physician, is that the value in terms of how much money we spend in healthcare has diminished over time. What we get in return and what we are putting money wise into healthcare, we just don't get that value. People are increasingly frustrated. Doctors are frustrated. Patients are frustrated. And we decided that instead of complaining about it all the time, we're going to do something about it. And so we basically stepped outside the traditional system and started doing direct patient care, and basically started redefining value in healthcare. So we started our practice called First Primary Care January 1st, 2016. So this is almost 3 years doing this. We have grown that model, and really it's a membership based model, and I believe, and we have proof of that it works a lot better for both the doctors and the patients, and cuts a lot of administrative waste out, as well as the middleman out, which I believe is the big reason there is diminishing value in healthcare.
Right. We were talking earlier about this. We had a little time to chat, and it's so interesting to get a perspective of, you're in the weeds of it every day. The average person has no idea about it, except for when they go to the doctor, and it's like, whatever the doctor says, I'll do that. And then whatever their pundits say on television about the healthcare, they have no idea on what is going on there. But we were talking about, you gave me the example of kind of like the Netflix idea, that Netflix said, hey, I got to, we have to step up our game. You want to kind of give me the example of what people, because people understand the Netflix model. So if you could kind of put it in that as a perspective, that would be interesting.
Yeah, I mean, I think, because healthcare has been controlled so much by the third party systems, mostly insurance companies and the government, the innovation in healthcare hasn't happened that rapidly as we have seen in other industries. Um, Blockbuster and Netflix is a very good analogy kind of to what's happening in healthcare right now. You know, all the blockbusters, as a friend of mine say, have been turned into urgent cares now. There are no more blockbuster stores. But if you think about it, when we wanted to watch a movie, we had to go to the store, pay 7, 8 bucks, hope to find a movie that you would like to watch, bring it home. You may or may not watch it, and by that time, you have to return the movie back. So it was a very cumbersome way of trying to get a movie to watch. There comes Netflix. And when Netflix was first introduced, there were many doubters that, oh, this is never going to fly. But Netflix changed that into a membership model. And now for 7, 8 bucks per month, you have choice of, several thousand, hundreds of thousands of TV shows, movies at your fingertips, and you can watch them at your convenience. And Netflix is about 15 years old, I want to say, and they completely disrupted that traditional brick and mortar kind of fee for service model. And I see
Right.
something similar happening in healthcare, especially at the primary care level.
Right, right. Something else we were talking about is, capitalism always has this, term they talk about is like, let the market will decide. The market always decides, the price of a product, or if a product is even useful, or if they even want the product. You were saying it's a little bit different in medicine. How so? The
You know,
market doesn't decide.
Currently, the way healthcare is, the market doesn't decide at all. There is no market in healthcare, right? The buyer of healthcare, the patients, which we all are, we have no idea what healthcare actually costs. We know what insurance costs, and we just keep paying more and more of, into that insurance industry, but we have no idea what actually the healthcare costs. But also look at it from the physicians and doctors standpoint. Most doctors don't know what their services are being sold at. More and more are becoming hospital employees, and they have no idea of cost. And,
Right.
and and as you know, when we make a decision to buy anything, we base it on cost and quality, what the value of that is going to be. And when you cannot make that determination, third parties then can hijack the system and inflate the care. A lot
That's
of
true.
fraud happening that we have no idea about, basically.
Right. I read an article a couple of months back. It was talking about, hey, if we just wanted to change the healthcare system, all we had to do was just get rid of fraud, and we could almost we could administer healthcare for a lot cheaper and have a better system. But for some reason, they don't want to tackle that issue. Do you have an opinion on that? Why,
Most,
like
most
why? I mean, it seems like some of this stuff is obvious when you hear about these, like OxyContin, these OxyContin factories that are going on in Florida, I think it was. These guys are making millions. They were making so much money that they because they couldn't put it in a bank. They literally had garbage bags full of money. It's like, what? Like, could they not know that this clinic's like ordering an exorbitant amount of OxyContin, that they might want to check them out? Like, who's
yeah,
paying for it?
exactly. And I think that's what happens when, the customer and the payer are totally dissociated, basically,
Right.
right? Because the payer is somebody else and you're providing service to somebody else. The doctors think that, okay, I can do whatever to a patient because he's not the payer, somebody else is going to pay. And patient similarly thinks that, look, I can get whatever care I want, I'm not worried about the bill because the insurance is going to pay, right?
Right.
So that does lead to a lot of excessive unnecessary care, um, and fraud. So in 80 to 90% of care is basically, outpatient care, more routine care. It is not, the catastrophic big bad stuff like car wrecks and cancers and stuff, right? And I think at least for that 80 to 90% of the care, there needs to exist a true market where a buyer buys a decision based on, okay, is this, cost wise, does it make sense for me? And value wise, does it make sense for me? And the
Right.
third
Well,
parties need to be out.
it's true. I'm glad you brought that up. E- like you said, how do we know as consumers we're getting something of value or not value? I'm like, what are we basing it on? And all we're basing it on is if we get home and the rash goes away, and as long as they didn't make me wait too long in the waiting area, that was good service.
Mm.
But the part that I really appreciate that you bring up is that, um, and this was back to my mom, that insurance companies are not doctors, but how are they telling us what we should be getting? And the doctor's like, well, if you want treatment, that's the only thing they're going to pay for. If you want something else, which what I would probably recommend, you're going to have to pay for it. So which one are they going to choose? When it
And
should be with the model that you're wanting, if I understand it right, it's you're taking the insurance out of that equation in the primary care section and saying we're going to do what is best for you, which is at the end of the day, that's what we should care about, and that's what we should be buying. We just don't know any better yet, and I think part of this stuff is like you're taking on a tremendous task of how do you educate the population that for so long has been brainwashed by, there's a lack of better term, these pharmaceutical industries and different, not that I don't want to say that all pharmaceuticals are bad, because they're not, but anytime you have a company that has a huge incentive, there's going to be bad actors. And that's where I think physicians they step in the middle, that if you take the insurance companies out and you put them in the middle and they say they should be there, the ones saying, no, that's not good for you, we're not going to give you that. And because it's
every physician takes a oath, that my first responsibility is do no harm.
right.
And I think we need to extend that to not only just physical, mental harm, but also financial harm, because that's very important as well.
Right.
And we want to work for our patients. We don't want insurance companies to tell us how it's done. We don't want government to tell us how it's done. And I think if you leave medicine to the doctors and the patients, they can figure out how to solve this problem. People sitting at the center trying to make decisions for 350 million people across the country, they will not fix this. The
Right.
healthcare solutions have to be local, and the doctors and the patients are going to have to get up. And like you said, we have been brainwashed for the last 50, 60 years. And so the process of educating our doctors and patients is huge, or hugely important to fix this.
Right. So our current system is, if you have a job, the job, the employer, hopefully if you work full time or whatever, you get insurance, and there's a portion that you pay and there's a portion that they pay. They usually choose who that insurance company is going to be. You have no choice. You either say, I want it or I don't want it. And if you don't want it, then you can go get your own. And whatever that company that they end up choosing, then it moves to the next level. Is it a HMO, is it a PPO, and all of in between? The consumers, we actually really have no choice other than if we work, which the majority of the people work, or at least they feel like they don't have a choice, because there's no other option to say, no thanks, Mr. Employer, I don't want that, but I do want this, and would you be willing to subsidize, and it's actually cheaper for you, this other stuff that I feel is better for me? Did I kind of marry those two to get that together to what you're trying to do?
Overall, I think choice when it comes to healthcare. So number one, again, I think the discussion needs to move from, when we think about buying healthcare, we only think of buying health insurance, and everything related to healthcare, we buy it through insurance, right?
Right.
Insurance has a purpose. Insurance is a tool. We don't use our car insurance to fill gas in our car. We don't use it to get an oil change, right? That would be silly. when it comes to healthcare, we use health insurance for every small thing. So I think, yes, insurance is necessary, but insurance needs to be restored to what it was originally designed for, and that is to cover large risk and
Right.
not the day-to-day stuff, right? And then people need to be able to make decisions on what they want to buy on their own. Employers can offer catastrophic insurances, but for the day-to-day care, I think the responsibility of where to go get that care should rest on the employee. And whether that is subsidized by the employer or not, that will vary from company to company and everything. But this whole idea of tax-free employer-sponsored healthcare, where again, employee really is not a true consumer and has no choice, I think also is a big reason why we have seen massive inflation in healthcare over the last 30 years or so.
Right, right. I look at it like anytime the government says to do something, that's probably not something you should be doing. Like, like get a 401k. Like, yeah, no, thank you.
People
um,
talk about Medicare for all that, all that stuff. I think there has to be a government sponsored universal healthcare system that covers again the big bad stuff, right?
right,
Not every day to day stuff. Eliminate that waste, eliminate all that administrative cost, and let the doctors and patients work together and clearly define value. And
right,
that's what we have done in our model basically is that we designed our model in a way where we charge people a flat monthly fee. We pair them with a personal family doctor, and we give our members excellent access to that doctor via text, via phone calls, via video chat, or via in office visits. And there is no additional cost to see that doctor. So now
right,
you're not kicking the can down the road whenever there is a health concern, but you can actually talk to your own doctor, whether you are in town or whether you're traveling anywhere. You have direct access to your own doctor. And this doctor works only for you. Now, think of it this way: if you are paying me a membership fee, my goal is to keep you as a member. So we continue to figure out how to add more value to that membership. Excellent access is one, same day appointments, longer appointments, heavy discounts on lab work, medications, imaging. We continue to add value to that membership to have more retention. And our now goal is to keep people healthy. And then we marry that membership to a more catastrophic wraparound plan that covers again the big bad stuff. And so have being able to do that, we were able to cut the costs basically significantly, improve the service, and we have seen that model actually take off across the country. And slowly, I feel like we are turning the wheels on this.
right, right. So, that leads me to the final question is where do you see medicine? It sounds like that's kind of where you feel like it's headed, that consumers do have access to information that was either kept from them or they just didn't care about, and now they're starting to care more about it. So you see it moving more towards the model that you are. First off, it's better care and it's cheaper or more affordable. I don't like the word cheaper. It just costs less and it's more affordable and you get better care. I mean, how could somebody say no to that?
Correct. And so for $100 a month for an individual, you get unlimited access to your doctor, like I was saying. Um, and this doctor is working for you to keep you healthy. Discounted labs, discounted medications, all that stuff provides great value. But when you do need the bigger system, when you do get sick, when you do end up in a hospital, you need specialists. You need somebody to guide you through that process, basically. And
Right.
our doctors have time to now be able to do that. That is true primary care doctor. Your family care doctor should be besides you when you need healthcare the most, right? In a traditional setting, the primary care doctors have 10 minutes to see you. And so it basically is either a referral or a test or an antibiotic. And that's what primary care has become in a lot of ways. So we are redefining primary care and redefining the value in the primary care setting. And again, when we talk about big bad stuff, there is better ways to do catastrophic care. Insurance is one way, but there are other ways to cover the big bad stuff. We rely on medical cost sharing models. And there is a
Right.
lot out there which talks about what is the difference between cost sharing and medical insurance. And I believe cost sharing is a lot more free market way of covering risk, keeps the consumer in the game, and there is a personal responsibility of that we have towards other members who are in the cost sharing model. So it's like a community that comes together to help each other pay the big bad stuff, and I believe that model is going to grow. The membership based primary care is going to grow, and we are going to be able to redefine value in healthcare. We're going to be able
Right.
to get technologies that help us deliver better care, keep people healthy. Nowadays, technology doesn't make it to healthcare because they are worried about, is insurance company going to reimburse this or not, or is government going to reimburse this or not? And if they don't, technology doesn't make it into mainstream. In a
That is so,
membership-based model, that is out of the picture, right? The only concern we have is how to provide more value to our members.
right.
We all walk around with supercomputers in our hands now, and you know how expensive the computers were, 20,
Right.
25 years ago. And when a market allows technology to flourish, progress happens. So I think these direct care models like direct primary care, medical cost sharing, are going to eliminate all the third party, the perverse incentives out of the system, and we're going to be able to bring sensible solutions back to people.
Right. I have a real world example with that. So I get a little rash. It's just in the pit of my arm. It's some tinea versicolor or something like that. Right. And it's just these pills. Right. And I get it at least once a year. And it's usually around the beginning of summertime. And I've been going to the same doctor for like 6 years. And you know what he makes me do every year? What do you think he makes me do?
He makes you come to the office,
He
wait,
does.
wait an hour, see you 5 minutes, waste your half a day basically for the thing you both know what needs to be done, basically.
Exactly. And I get so pissed. And every time I call, I'm like, why? I come every year. I could send you a picture of it if that's what you need. And then I go in. So I pay, I have to, the crazy thing about these high deductibles so you can have an affordable monthly bill is that it's that affordable monthly bill that you start comparing and you go, oh, okay, that's good. You totally forget about this high deductible. So when you actually go in for your primary care, which majority of the time that's where you go, insurance doesn't pay for anything.
Mhm.
Like pretty much, you got to go in there and it's like it's $103.
Yeah.
And that I know that most of that, and then I get the bill. I'm like, he billed him like $500. He could have just looked at a picture, similar to what you guys got. You got this app. Take a picture. Yep, it looks like it's the same thing as last year. We'll store that on a file. Here, I got your prescription, and you pay what the wholesale and not marked up. I have to pay $68 for this particular drug because they don't have well, if they do, they don't offer it to me.
Mhm. Mhm.
$68 and then another 103. So I'm paying $170 that I could easily, in your model, it's like, yep, that's what it looks like, Randall, from wherever I'm at, and we'll have it, sent to you. It's like, that's crazy. That shit drives me nuts. It doesn't need
Absolutely.
to be that way.
It totally doesn't need to be that way. The other
But the
day,
system, it's the system. Like you said, it's the system. He's not going to get paid unless he has me come in because they won't allow him to
right,
charge me if I don't come in for an office visit. I mean, I
right.
don't blame the guy. He has to make a living, but
Yeah, he
he
is doing.
maybe needs to look into a different model.
Yes, exactly. And that's kind of the first step is that, people need to get out of the system and do something differently, right? And there is a whole education component to it. And hopefully we can inspire more and more people to step out and say, look, we got to step out if we have to fix this. We can't just sit around, wait for our politicians to fix it. And again,
Right.
I firmly believe that healthcare solutions, if you really want to make them work, they need to be developed locally because, you know, people are different, um, local circumstances are different. So sensible solutions that apply in a particular market need to develop in local markets. And that's what we are doing. Again, I think we want to provide direct care and we want people to see the value they get. Last Friday, I was talking to a dad who was visiting, I want to say Austin or something, and their kid had belly pain. At evening, I'm talking to them, and they were worried about appendicitis, and they wanted to take the kid to the emergency rooms. I spent 15 minutes on the phone, reassured them. We watched it, monitored it, and the kid got better, didn't need to go anywhere. When they come back, they came back Monday. We saw them in the clinic. Everything is fine. If he didn't have a service like ours, that was an emergency room trip and at least a $3,000 to $5,000 bill. That's 3 to 5 years membership in our clinic. And so,
Wow.
you know,
That makes a big difference.
and that's what I mean by redefining value. We need to give people excellent access to a primary care doctor so they are not, going to emergency rooms, urgent cares, hospitals unnecessarily. And I think by fixing primary care, we can save the system a ton of money. 20% spend of the GDP we are spending in healthcare. And what I have seen that do is it has crowded the funding in other sectors. There's less to pay for education, less to pay to rebuild our roads, less to pay our teachers. And wage freeze has happened in the last 30 years. People's wages are not going up because I believe a lot of this money is being funneled into healthcare. And there is data to prove that. And it is just not sustainable. So again, instead of complaining about it, we decided to do something about
Right.
it.
Right. So we have when you do a live show, you have to always predict that always a potential for technical difficulties. Um, Sometimes with the audio, when you're doing it over the internet, you have a jump in. But I wanted to sum up a couple of things while we're trying to get his audio back where um, everybody can hear. Um, our current system is set up where you basically have no choice if you get it from your employer, they choose the plans, who they're going to get it from. They determine like how much they're going to pay and then how much you're going to pay, and you have to go with it. And then whatever that plan ends up being, and whatever doctors, where it's an HMO or PPO. I profess to be an expert in this. I just know because we've provided insurance to our employers as well. And then you got to go with it. You have no choice. You rarely use it. You hope that you actually never use it. And they call it health care when it's actually sick care, because the only time you're ever going to actually use it is when you're sick. And the model that we're proposing, or that Dr. Goyal and the rest of his team is proposing, that there is a better model, and it exists, and it's his model. It's the first primary care model, the deep direct primary care, which is everyone should have their own personal assistant. They like to say, if you had a doctor in your family, that doctor is usually the busiest person. And from family members calling like, hey, this happened or this. They always have questions. It's just like have a lawyer in the family. It's like he's going to get a lot of calls from family members. Did we get you back on? Okay, so I can hear you now. Good. I'm just kind of filling in the gaps while we got the sound back. So you back to what you were saying, because we kind of lost you in the audio there where you were summing up your thoughts.
Yeah, I mean, I think again, we need to get insurance out of majority of healthcare. Majority of healthcare is outpatient, and if we take 80 to 90% of what a primary care doctor can do and sell that on a membership-based model, it makes a whole lot more sense, cuts a lot of administrative waste out of it, and lets the doctor work for the patient. The doctor-patient relationship, which is very important, there is time for it to flourish. And then we
Right.
marry with a true catastrophic plan that makes sense, that can cover the unpredictable things in healthcare that can happen. For example, a car wreck or a heart attack or a cancer and stuff like that. And I think government has a role to play, but at the big bad stuff. When
Right.
government is in every small thing, it just creates more regulation, more unnecessary work, more administrative burden, and that does not benefit anybody, but just inflates the cost massively. So we can
Right.
do better. People are doing it better. The solutions that we are talking about are actually there. Um, and slowly I have seen them, scale over time. And I believe education is the key. We need to educate more people on how to demand more value for the dollars they are spending in healthcare.
Right. Well, you had a couple of questions here. One of them is are you so you're building these models? You'll have two here in Houston area, right? You have one in the Woodlands, and you have one in Spring Branch currently, right?
That's correct.
And as somebody they're from San Antonio, they were asking about the model in their city. What would you tell somebody like that? I know that you're working on. You would love to have them in every city, and that potentially could be where you're headed.
Correct. We want to develop Houston first. Again, like I said, healthcare has to be local. But the movement of direct primary care has grown almost 80 to 90% each year. When we first started our clinic in January 2016, we were the second clinic in Houston to open. Now there are about seven clinics, different independent doctors doing the same model. And I have seen that growth, at a similar pace happen across the country. So I'm sure there are doctors in San Antonio that are operating under the same model. If not, there will soon be somebody opening it under the same model in San Antonio as well. I highly encourage your viewer to check that out. They can look direct primary care in San Antonio and see what they come up with. We are happy to help them as well. Our catastrophic plan is available across the country. So we can definitely help people with the catastrophic portion, and we can then pair that with a good primary care doctor in their city to go along with the catastrophic model.
Right. And then you had a question if you could quickly walk them through the process. If somebody, reached out to one of your representatives, what would that process look like for them? If it's not too long, if it's too long, if someone had insurance and they decided that they wanted to, revisit something else, if they had an employer, and then someone who had no insurance, is that a quick answer
Correct. And I
for what
think
that process would look like?
go to our website, firstprimarycare.com. They can call us or they can fill out a form and we will contact them. Everybody is different. Everybody's situation is different. What they are trying to get out of, healthcare or for their own health is different. So we customize our
Right.
solutions. It is not the same, cookie cutter approach for everybody. So best thing is let us understand where you are, and we will help you accordingly.
Awesome. Well, I think you just said it there, but if somebody was interested in your service, so they wanted to get have somebody take a second look at what they have and see if there's something that could save them money, or if they wanted to get something that was more valuable, maybe they don't even have insurance. Where would you like them to go?
Firstprimarycare.com. Go to our website. There is a ton of good information about our primary 365 program and complete 365 program. So our complete 365 program is a complete health solution, which is about half the cost of a traditional health insurance plan. And I want to say 3 times, 4 times the value. Um, and there is really no value. You can't put a price to a good doctor-patient relationship, to be honest with you. And that's kind of at the base of our model, or kind of the hub of our model. And so our website is the best place to go. Um, and we do health coverage reviews. That is our specialty. That let us take a look at what you are currently doing, how much you are spending, and let us show you some other solutions. And then you figure out where you want to put your dollars, where you're going to get more value. And our solutions are, again, more free market based, more direct care based, and they just work better because a lot of the third parties are out in our model.
Right. Well, again, Dr. Goyal, I wanted to thank you for taking the time to come on here and share your thoughts on, giving us some better solutions, kind of educating us a little bit. I know your time is super valuable, just like everyone else here that's on the show. I wanted to thank everybody for viewing today. Hopefully you found value in it. Again, go to firstprimarycare.com. They can do a free health coverage review. Now, this isn't one of those, because you see this with insurance companies and other types of companies where they say, hey, just call us and we'll give you a review and we'll sell you insurance. That's not what they're suggesting at all. It's more about educating on looking at what you have. Maybe what you have is best for you, and they don't need they're not in the business of selling insurance. They're in the business of providing the best health care for you. And maybe there is a solution that inside using them or not. So again, go to firstprimarycare.com. And again, Dr. Goyal, I know you're out in the field right now. So, again, I appreciate you taking the time.
Thank
And for all of those who are not currently following me, you can go to Facebook/Think Like a Marketer Show. Go ahead and like, follow, and share. If you've got value out of this, be sure to share it with your friends. Maybe they'll learn something that they didn't know. Hopefully we did a good job in at least giving you the basics of it. I mean, we had you for 30 minutes. I think we could probably go for 30 years and try to reprogram people. And we just don't have that kind of time. So again, and if you haven't, go to Think Like a Marketer Show YouTube channel. I put a lot of other interesting stuff behind the scenes, interviews, tips, tricks, and resources for business owners. Dr. Goyal and I actually did some other interviews that I'll be uploading that it's a little bit more in-depth questions that we didn't have time to answer today. Again, thanks everybody for coming on, and we'll see you next week.